Good morning, everyone. I'd like to welcome you to this joint press conference of the Lepanto Institute and the Population Research Institute. I'm Steve Mosier, the president of the Population Research Institute. Here with me today are Michael Hitchborn, president of the Lepanto Institute, and also his senior analyst, Rob Gaspers. We're also joined by well-known moral theologian, Christian Bruegers. We are here today to release the results of a year-long field investigation of Catholic Relief Services projects in 3 African countries. These countries are Cameroon, Zimbabwe, and Lesotho. And yes, I said year-long investigation, and it was an investigation that involved sending investigators to do on-the-ground research in these 3 countries of CRS projects. We do not take the questions that we are about to ask lightly, nor should we. These are questions that involve the health not just of bodies, but of souls. I'm talking about the souls of girls and young women aged from 10 to 24 years of age, who are the targets of certain USAID, PEPFAR-funded projects in Africa. That's USAID, the United States Agency for International Development, and PEPFAR, the President's Emergency Plan for AIDS Reduction. CRS has participated in these projects in various questionable ways. The press conference will consist of 3 short presentations of our findings in Cameroon, Zimbabwe, and Lesotho, respectively, given by Michael Hitchborn and Rob Gaspers. This will be followed by reflections by Dr. Christian Bruegers, a moral theologian, and a Q&A session. One final comment before we begin the country reports. Our investigation and analysis was guided from the beginning primarily by 2 papal documents, Caritate in Veritatis and Pope Benedict's 2012 motu proprio on the service of charity. The questions we ask about the CRS projects in Cameroon and Lesotho and Zimbabwe followed Pope Benedict's very clear direction in his motu proprio. These questions were: do these charitable projects in Africa follow Catholic principles, or did they involve commitments which negatively affect the observance of those same principles? Now here we're looking primarily at Catholic moral theology governing human sexuality. Another question: were local diocesan bishops in Africa allowed to exercise their legitimate authority over the, quote, activities and management of these projects to ensure that the norms of the Church's universal and particular law were respected, end of quote? Another serious question. Were the intentions of the American faithful, who make donations and bequests in the understanding that these funds will only be used in accordance with church teaching, being respected in these African projects? And another question directly from the motu proprio. Did CRS take care to ensure that it selects its personnel from among persons who share, or at least respect, the Catholic identity of these works? Another question. Did CRS take care to ensure that the African faithful, and here we're talking about young girls, are not led into error? Finally, 2 questions. Did CRS receive financial support from institutions, in this case USAID and PEPFAR, that pursue ends contrary to Church's teaching? Related to this is the second. Did CRS receive funding for the implementation of initiatives, even in part, whose ends are not in conformity with the Church's teaching? Again, questions directly from Pope Benedict's instruction. The answer to this last double question is quite obviously yes, and yes on both counts. USAID and PEPFAR pursue ends, among them increasing the contraceptive prevalence, and another one, increasing the contraceptive mix, that are clearly not consonant with the Church's teaching. Furthermore, as we will document today, The CRS is a lead implementing partner in the USAID PEPFAR-funded project called DREAMS, which has the firmly stated goal of increasing the use of contraceptives among adolescent girls and young women. Now, the answer to all the remaining questions I just asked is no. We believe that the CRS projects we investigated are at odds with the Church's teaching and do not, I repeat, do not adhere to Pope Benedict's 2012 instruction on the service of charity. This in itself is a matter of scandal. We respect the good that CRS does in many of its other works, those that do not involve cooperation with USAID PEPFAR's fertility reduction and contraceptive promoting goals. But what does it profit the Church if its charitable arm intending to save lives instead leads souls into error and perhaps causes them to be lost? But we will let you decide the answer to these questions that I just asked yourselves, because we're now going to present the evidence on which we base our findings. First up is the president of the Lepanto Institute, Michael Hitchborn, who will present our findings from Cameroon. Michael?
Thank you, Steve. The research that we're talking about began actually in 2019, and it led to a series of reports that was published by the Lepanto Institute in 2020 showing that Catholic Relief Services had published a series of documents promoting condom use, ran an internet library that housed documents promoting abortion and contraception, created a health referral network in Cameroon and also in Nigeria that sent girls to abortion-minded contraception providers, and led the implementation of a PEPFAR initiative designed to increase the use of contraception called DREAMS. These reports went largely unnoticed in 2020 due to a series of chaotic events all over the world. So after discussing these reports with Steve Mosier and his team, we decided that what we found was serious enough that we had to send researchers to some of these project sites to find out what was really going on. So we sent a team of researchers to Cameroon, Zimbabwe, and Lesotho to look into CRS projects there. In Cameroon, we looked at the KIDS project, KIDSS, and I'll explain what we found there in just a moment. In Zimbabwe, our investigative team looked into CRS's project called Pathways, which was responsible for the implementation of DREAMS. And in Lesotho, our investigators examined CRS's implementation of the DREAMS project there as well, and its involvement with another project called Karabo Ea Befolo. Through the examination of primary sources found online, and interviews and materials that were obtained by our investigative team in Cameroon, we found a shockingly high degree of complicity in the promotion of grave moral evils on the part of Catholic Relief Services. From June of 2014 to June of 2019, Catholic Relief Services was in charge of a USAID-funded project called Key Interventions to Develop Systems and Services for Orphans and Vulnerable Children, KIDS. Our initial research from CRS-produced documents indicated that KIDS was involved in sexual and reproductive health programs for adolescent girls and young women. And before long, we discovered that the SRH component was a part of a health referral scheme created by CRS for the project. And what we discovered about the referral scheme was that CRS's handpicked several contraception-providing organizations to send girls for sexual and reproductive health services, one of which was notorious and publicly advocating for the decriminalization of abortion. So the first thing that I want to show you, that our researchers got a copy of this manual. It's called What Do You Want to Be When You Grow? Okay, so you can see it right here. The acknowledgments page of the manual was developed for the Kids Project in the Kids in Cameroon project, and indicates the support of Dr. Leslie Chingang, who was CRS's Deputy Chief of Party in Cameroon from 2014 to March of 2023. It also acknowledges the kids team in the editing, review, and compilation of the manual. And 2 other individuals are specifically thanked for, quote, recommending use of this manual to Catholic Relief Services. And one thing that you'll notice is right here at the top is CRS's logo. This manual, once again, was obtained at CRS's office in Cameroon. Shockingly, the manual indicates quite a few sections that were taken from a program called My Changing Body, which CRS test piloted in Rwanda in 2009. In 2015, I personally researched and published a detailed report on CRS and My Changing Body, showing that it included strong promotion of masturbation, and despite the evidence to the contrary, CRS publicly denied implementing any aspect of the promotion that promoted masturbation. Well, on page 12 of this document is the first mention of masturbation, found in a chart that indicates that it is a myth that masturbation causes bacteria to build up in the penis and the vagina. Page 13 includes a graphic depiction of female reproductive organs. I'm not going to show it here on screen. And page 13 includes a graphic depiction, page 21 is an activity that goes into methods of safer sex. On page 23, okay, it's right here and you can actually see it in the report, but on page 23 here, the instructor is told to ask the students for examples of safer sex. And then it says, discuss the following methods for safer sex. After abstinence, the manual says, quote, hugging, holding hands, kissing, and masturbation, in parentheses, touching your private parts, close parentheses, are also safe practices. Pages 65 and 66 of the manual provide answer keys for a pre- and post-test on pregnancy, puberty, life skills, and HIV/AIDS and STIs. Questions 16 and 17 of the test on page 65, which are true and false statements, are related to masturbation. Question 16, which is marked true in the answer key, states both men and women masturbate. Question 17, which is marked false, states masturbation can cause people to go crazy. What is clear here is that CRS, through their own document, again, right here on the front cover, CRS's own logo, in their own document is indeed the promotion of masturbation as a form of safe sex, and this document completely contradicts their claim from 2015 that their use of My Changing Body does not promote masturbation. Here's something else that we discovered. This logo is from an organization called Renata. It's a French acronym that translates into the National Network of Aunties, and you'll note that the logo itself is an icon for abortion, as it depicts a very pregnant woman with an X through the location of the baby. This little booklet right here, which our investigators obtained from Renata's office, is an SOP that refers for the referrals for the health referral network in the Kids Project. On the bottom, once again, is CRS's logo. And in the booklet, it not only states that Renata is a partner organization in the Kids Project, but that its operations are outside of faith-based health facilities. And in parentheses, it puts the word Catholic. In this chart, let me pull this up real quick. In this chart, there we go. There. In this chart, we obtained through an official USAID memo, you can see that the Kids Project has a reciprocal relationship with Renata, where girls are sent for sexual and reproductive health services and education. Here it says OVC Service Package Kids. There's an arrow that goes here to Renata. Down here it says Comprehensive Sexual and Reproductive Health. And then there's an arrow that comes from Renata back into the Kids Project. Our investigators went to Renata's office and obtained a copy of their sexual and reproductive health manual. And I'll show you just a few pages. Well, I'm not going to show you this first page because it's horrifying. It's a very graphic image of female reproductive organs. On page 19, which is right here, is a page about abortion. And it says, let me get my place here. Okay. It instructs girls to not attempt abortion in their own merit, but to have one at a hospital. And on the next page, it's all about various forms of contraception. So the sexual and reproductive health services being referred to for Renata are very clear. This chart here, which again is in the full 120-page report, this chart here shows financial disbursements from CRS to Renata as far back as October of 2019, when the Mexico City policy and the Siljander amendments were both in force. Those amendments, by the way, the policy and the amendment, forbid federal funding of abortion providers or advocates, and that includes any sub-grants from primary grant recipients. And given Renata's open advocacy for abortion, it's hard to see how CRS is not in violation. Other contraception promoting organizations that CRS identified as partners are Horizons Femmes, Morenzo, and SWAA. And I direct you to the report to find the information on them. Our research team in Cameroon discovered that the Kids Project formally ended in 2023 and is continued under a new name called Cosmo. While the Bishops' Conference of Cameroon is formally in charge of Cosmo, our researchers noted that CRS maintains a prominent presence in the project, and many employees who had worked for CRS are now working for Cosmo. For instance, CRS's project officer for case management in the Kids Project, a man named Dr. Leu Donatus, is now a zonal manager for Cosmo. What should be noted about him, however, is that he is an abortion and contraception proponent. As you'll see in the report, Dr. Donatus openly advocated all forms of contraception, including abortifacients, during his time as CRS's project officer for case management. While working for CRS, he called contraception, quote, a vaccine against poverty. Even now, he maintains this advocacy and very recently stated that abortion is a human right. One of the most important things to note about Cosmo is that it relies upon the very same referral network with Renata, Horizons Femmes, SWAA, and others, meaning the network that was established by CRS is still in place. And young girls continue to be referred to abortion and contraception peddlers. But what our researchers discovered at Catholic hospitals in Cameroon have been enlisted as partners in the Cosmo project and provide pornographic sex education materials promoting contraception and condoms. The materials themselves are supplied by CARE and Georgetown University, organizations that CRS often partners with. Here I will show you just one of the flip charts our researchers photographed at the hospital, and I had to censor it because it is extremely graphic. It's I don't know if you can see it in the camera, but there's a naked couple in bed here. There's a naked homosexual couple in bed here. There is a sex act being described here. And then there are a series of contraceptives and condoms down here at the bottom. Additionally, the Catholic hospitals confirmed to our researchers that through their partnerships with CARE and Georgetown University, they distribute contraception and condoms. During the course of our investigation, our research team had an opportunity to sit down with the Archbishop of Yaoundé, and the stark difference between his understanding of the Kids Project and Cosmo Project and what is actually happening is worlds apart. He had no idea that the CRS-led Kids Project, and even now the Cosmo Project, were being used to promote masturbation, contraception, and even abortion among the members of his flock. And from what he told our researchers, he would be absolutely appalled to learn of the pornographic material in contraception and condoms that are being provided and promoted through his Catholic hospitals. What is abundantly clear is that Catholic Relief Services is introducing abortion and contraception-minded organizations to a deeply vulnerable and religious people, and doing so without the knowledge of the local Catholic bishops. And through those partnerships, the minds and souls of young people are being warped and ruined. It was CRS that brought Renata and Horizons Femmes, SWAA, and others. It was CRS that provided materials that promote masturbation as a form of safer sex. And it was CRS that financed the participation of an abortion advocate whose very logo is an icon of abortion during a time when such funding was forbidden. And for now, I refer to the rest of the information in that report to go to the report to see it.
Thank you, Michael Hitchborn, for that report on Cameroon. Now I want to introduce to everyone Rob Gasper, a senior analyst at the Lepanto Institute, who will present our findings from Zimbabwe. Rob?
Good morning. As Michael pointed out, we started this research in 2019 primarily on CRS's programs for orphans and vulnerable children, and published a series of reports in 2020. And one of the projects, the one I'll be covering, is called DREAMS, which means determined, resilient, empowered, AIDS-free, mentored, and safe. This was created by PEPFAR in 2014 and primarily funded by USAID. We found CRS activities involving DREAMS, where they ran projects for DREAMS in several countries, including Uganda, Kenya, and Lesotho, and had found that DREAMS has the provision of condoms, contraception, and graphic sexual education as a primary and essential component for every girl that is enrolled in the program. We also saw at the time that CRS was implementing a DREAMS project in Zimbabwe. However, we did not have sufficient evidence to write a report in 2020. So when we were discussing areas that we wanted to send these investigators that we worked with, we figured that Zimbabwe would be a great place to look. So this is the result of our investigation in Zimbabwe. And this on-the-ground investigation gives us a full picture of the operation of the DREAMS project in Zimbabwe and of the key role that CRS played in its implementation through the USAID-funded program called Pathways. Here's what we confirmed. Number one, the DREAMS project, as conceived and implemented, is entirely incompatible with Catholic moral teaching. Number two, CRS knew about the moral incompatible nature of DREAMS and was complicit in its implementation in Zimbabwe. Number three, all DREAMS enrollees in Zimbabwe were mandated to receive exposure to condoms, contraception, and sexual and reproductive health education. Number four, CRS was aware of this mandate and knowingly referred girls to implementing partners who provided exposure to condoms, contraception, and sexual and reproductive health education. Number 5, many of CRS's hand-picked implementing partners provided contraception and even referrals for abortion during the time period of the Pathways Project. And number 6, other DREAMS partners in Zimbabwe stated that CRS supported the provision of condoms in school and claimed that CRS gave them access to young people, mostly Catholic, who they otherwise would not have been able to reach. So let's discuss the DREAMS project. What is this thing? PEPFAR created DREAMS in 2014 as a means of reducing HIV among girls and young women, especially vulnerable ones in African countries and also in Haiti. USAID, as stated, is the primary funding partner of this program. Now, the main DREAMS innovation is its development of a standardized, evidence-based core package of services that it delivers to each and every girl that is enrolled in the program. And they use sophisticated data management and referral systems to make sure that every girl enrolled receives every part of the package. Our report goes to great lengths to prove from multiple sources that a major part of the DREAMS core package of services is dedicated to the increased usage of contraceptives and condoms among adolescent girls and young women. But in the interest of time, and it's a 120-page report, I'll just provide a few key highlights here, and I'll refer you to the report for the rest of it. In a document titled The DREAMS Core Package of Interventions Summary, PEPFAR indicates that its core package of interventions includes increasing the contraceptive method mix, and it says, in quotes, increasing the variety of contraceptive methods available to women will also help keep them HIV-free. In this chart, which comes from a peer-reviewed article on DREAMS from BMC Public Health, it's clear that the provision and promotion of condoms and contraception is an integral aspect of the DREAMS core package. This is the this one. This is the DREAMS core package as given by BMC Public Health. And you can note that in the core package, 3 of these 7 things are adolescent-friendly sexual reproductive health services, condom promotion, and the contraceptive mix. And then the outcome is they're looking for the use of condoms, and the use of condoms, again, for both adolescent girls and young women and for their male partners. However, the most detailed and definitive description of how PEPFAR intends condoms and contraception to be implemented in DREAMS comes from its 2015 document titled Preventing HIV in Adolescent Girls and Young Women, Guidance for PEPFAR Country Teams on the DREAMS Partnership. Now, this is a guidance document. This is basically the rule book for DREAMS for all of its country teams. So CRS, being a leader of a country team, would have access to this rule book and would be needing to follow all of these rules. So from this document, on page 20, it states that it's unethical to refuse condom distribution to high-risk populations, and suggests that the teams should capitalize on a woman's desire to avoid pregnancy as a means of increasing condom use. Page 21 goes on to justify the promotion of IUDs and hormonal implants, arguing that increasing the contraceptive method mix in this way leads to lifelong education and economic opportunities and achieving fertility goals. So, just as a side note here, these are not, from a secular standpoint, you can see that you may use condoms as a barrier to HIV, but these IUDs and hormonal implants have no such effect. However, you can see that they're trying to increase their fertility goals, which is lower the fertility rates in these African countries. It has nothing to do with HIV, but that's a side note. A chart on page 50 specifically rules out abstinence-only education. So if you're part of the DREAMS program, you may not teach abstinence-only education. You must teach, if you teach abstinence, you have to teach it in conjunction with condom usage, which means CRS can't even fall back on that as a defense for its involvement in the project. Now, the DREAMS logic model, which is found on page 32, this is from PEPFAR. As you can see, it shows condom promotion and the contraceptive mix expansion, again, being a key part of the flow of services to these young women through the program and then to the outcomes, which is to reduce the, and here again we see that the reduction of the number of pregnant 15 to 24-year-olds is part of the desired outcome of this program, which again shows that this is also a population control program. Now, the clearest illustration of what is included in the DREAMS core package comes from CRS itself. So, from a CRS document that we obtained from the Lesotho DREAMS project, CRS showed what it understood to be the core package of services in DREAMS. CRS claims that they were only working on this part of the core package, which is strengthening families. But as you can see here, part of the core package is the youth-friendly sexual and reproductive health care, condoms, and the contraceptive mix. Now, CRS here, as you can see, has cordoned off this area and this blue shaded area to show that they have a little carved out section of this project. So they can say, we never distributed contraception. We're just doing this part of the project. We'll see if that holds water. However, DREAMS in its entirety is a program designed to expose all of its enrollees to contraception, and there is no way to effectively carve out a safe part of this program to implement. One of the things our team on the ground in Zimbabwe discovered was the way the service package is layered in the DREAMS project. Now, what this layering means, what this means is that every girl enrolled by CRS for one part of DREAMS was necessarily referred to each and every one of the remaining core services, including those which specifically promoted and provided contraception and graphic sexual education. Here's what we know about the layering of services in DREAMS. Now, going back to the guidance manual, the DREAMS instruction book, here's a quote on page 10. Achieving a layered core package of services for vulnerable adolescent girls and young women and avoiding a piecemeal approach means that a variety of partners in a variety of locations must coordinate their activities and standardize their operations such that they are able to plan and track layering of interventions at the level of the individual girl. So, in other words, a girl can't just get a piece of the program. It says, can't do this piecemeal. The organizations involved, the country teams, need to coordinate amongst each other and make sure that every woman gets every piece of the project. Now, looking at the project in Zimbabwe, there were 4 primary leaders of the project. Each of them the country was basically carved up into sections. Population Services International was one leader. Africaid was a second. Another organization called FHI 360 was a third. And CRS was the fourth. CRS had a DREAMS project called Pathways. Now, CRS in the Pathways program had to choose its sub-partners. CRS chose them itself. And these included Caritas Zimbabwe, Childline Zimbabwe, the Jointed Hands Welfare Organization, J.F. Kapnick Trust, and the Salvation Army. Now, there may be a question, well, maybe in Zimbabwe the DREAMS program didn't mess with contraception. Well, if you look at Zimbabwe's country operation plan for DREAMS, it identifies sexual and reproductive health education and condoms as components of the DREAMS core package. So there's no question that this is part of Zimbabwe's DREAMS project, and also from the evidence you'll see in just a moment. FHI 360, which was one of the other prime implementing partners, one of the main ones, stated in one of its reports that all DREAMS beneficiaries must access the primary package, and the program supports them to access the needs-based secondary package. And if I could have this slide, thank you. This comes from FHI 360's report on DREAMS and how it approaches DREAMS. And as you can see, for girls as young as 10 years old, the primary interventions include condom education, condom promotion and provision, and for older women, condom education as well. In the secondary services, they include the contraceptive method mix. This will be coming up again, talking about the primary package of services. That's the one that every girl must get. So, to restate, the purpose of DREAMS is to deliver a core package to girls and young women that includes condoms, contraception, and graphic sexual education. All prime implementing partners need to ensure that girls enrolled receive the entire core package, making referrals if need be. So, even if CRS never distributed a single condom itself, as a prime implementing partner for DREAMS, CRS was not just a participant, but a leader in a project designed to spread condoms, contraception, and graphic sexual education, and would, by necessity, due to the project's own rules, be referring any vulnerable girls they enrolled to other groups for condom and contraception education and provision. Now, did this happen in practice, or is this just on paper? That's why we sent a team to find out. Because a lot of times when you're just researching these things and looking through project documents, this may not be the reality that happened on the ground, but may just be somehow reported. We've had CRS say this before, that things were just reported that didn't happen. So we had a team, and they checked it out. So did this happen in practice? Yes. Our investigators met with CRS Zimbabwe's Deputy Chief of Party. His name is Richard Savo. In the course of this interview, Mr. Savo confirmed to our investigators that DREAMS included sexual and reproductive health as part of its core package of interventions, and that CRS was required to refer girls to other implementing partners to receive these services. His explanation of DREAMS, verbatim, is in a quote. He says, "DREAMS is a consortium of partners providing a variety of services, and the services are divided into two. There are the primary intervention services and the secondary intervention services. Then the primary intervention services are those issues around social asset building, sexual and reproductive health, education. What else falls under that? Economic strengthening for adolescents, and also issues around parenting. So they will then say these are mandatory interventions that the adolescent girl and young women must go through. And there are partners who provide those services. Then, after you have been going through the package of primary services, then there is a secondary package, which is on a need basis. That one is not mandatory. The primary one is mandatory. And that was his direct quote. Now, after explaining the secondary services further, he added, then they will go through the whole process and be linked to the various service providers until their situation improves. So, in short, the Deputy Chief of Party for CRS's DREAMS project in Zimbabwe said in his own words that sexual and reproductive health is a mandatory intervention. CRS is required to ensure that adolescent girls and young women that it enrolls in the DREAMS project are referred for this sexual and reproductive health as a condition of participating in the program. CRS not only knows that the girls it sends to other partners for sexual and reproductive health will be given graphic sex education and provided with condoms and contraception, but is also a willing provider in this process. Now, Mr. Savo also gave our investigators a digital copy of what was called a DREAMS Service Passport. This is a 12-page document that is provided to girls that are enrolled in Zimbabwe's DREAMS program. This passport gives detailed and very explicit referral information on the kinds of contraceptive services available to enrollees. As you can see here, this is what the title page looks like for the DREAMS Service Passport. This is on page 4. It says, I can access all of the following DREAMS services, including contraceptives and male and female condoms. Further on, these are more services I can access. To be AIDS-free, I can get these contraceptives and family planning from PSZ, and male and female condoms from SESHAR, and other organizations involved in the DREAMS program in Zimbabwe. And continuing, and these are the addresses of some of the other organizations involved, and the places where these girls can call to get these things done. And so every girl that was enrolled in this program was given this passport that gives them all of this referral information. So that's another key piece of evidence, and you can find the entirety of that in the full report. Now, an illustration of this process in action happened during CRS's 2022 broadcast of the closing events of the Pathways Project. Now, this was on Facebook. Remember, Pathways ran from 2018 to 2022. It was a 5-year USAID project. Now, during this closing ceremony, CRS, and this was CRS's broadcast, CRS called up a young woman named Bethel, who is now a DREAMS ambassador, to give her testimony about her experience with the DREAMS project. She indicated that she was recruited by CRS's sub-partner Childline. And then she clearly referenced condom promotion by telling the audience that she learned about using protection in sexual relationships through DREAMS. And she specifically stated she learned this through DREAMS. And the audience was full of CRS staff and CRS staff in T-shirts with CRS's logo. They didn't bat an eye about this. Another example we discovered of this kind of layering of services and collaboration by CRS with other organizations is CRS's participation in something called the Stop the Bus campaign. Now, Stop the Bus is an initiative of the DREAMS partners in Zimbabwe, all the prime implementing partners, and is described as a one-stop shop for survivors of gender-based violence to access medical care, emotional support, legal support, screening, testing, and counseling for HIV. That's the whitewashed description. Now, multiple partners in the DREAMS project confirm that condoms and contraception were heavily promoted at these Stop the Bus campaigns, and also that CRS is heavily involved in the campaigns. For instance, a year ago, one of the DREAMS partners named OFID posted about a Stop the Bus event on Facebook and mentioned CRS's participation, as well as identifying all the family planning services that would be provided there. This was also taken from that Facebook post. If you look, here's the DREAMS banner, and this was during the Stop the Bus campaign, listed first. It's a little blurry on this because we had to zoom in. It says, hello, you can access this important information and services on, first, male and female condoms. CRS was present at this and helps run these things. Most troubling is the evidence our investigators found when meeting with CRS's chosen sub-partners. So our on-the-ground investigators went and interviewed all of CRS's sub-partners. First, Caritas Zimbabwe. Our investigators held a meeting with the development coordinator along with 2 Caritas community health workers. Now, Caritas is also a Catholic organization. This would be the local one in Zimbabwe run by the diocese. During this meeting, the 3 Caritas workers confirmed, while discussing how HIV prevention is taught, that the full spectrum of ABC, which is abstinence, be faithful, use condoms, was taught to both children and adults. So in their teachings on HIV prevention, they were doing the whole thing. They weren't just teaching abstinence only. That would be against DREAMS rules. And then these Caritas workers repeatedly during this interview referred to condomizing the teens. And then when they were asked to share their facilitators' manuals, they refused. Now, during the investigators' meeting with Childline, it was confirmed that Childline refers young women for emergency contraception and abortion in rape cases. The investigators noted that there were condoms and contraception on offer in the Childline offices and also in their restrooms. Our full report has many pictures of Childline materials that were on display, showing how to use both male and female condoms. Our investigators also visited the offices of J.P. Kapnick Trust, an organization whose mission is to serve people with special needs or who are living with a disability. But J.P. Kapnick also carries out campaigns that provide and promote condoms and contraception for individuals living with disabilities. And I should have here this is something that we obtained by our investigators from J.P. Kapnick's office, which is a sign language book for sexual reproductive health for young people. And it is Yes, it purports to be intended to protect youth by giving them the signs needed to describe something that's happened to them, and that makes sense. However, this goes well beyond that and gives graphic signs for perverse activities, and it also explicitly promotes condom usage and transgenderism. So, yes, you can see slides from this in the full report. I'd rather not show some of this where there may be children watching this stream. Thank you. Our investigators also met with Salvation Army. They met with a Christian pastor there who approved of providing condoms to school students during the same time that CRS was working with them. And also explained how Salvation Army had promoted and provided contraception in district schools against the wishes of parents. Now, there are further examples of CRS's subpartners and the investigators' interviews in our full report. And just keep in mind, these are CRS's chosen subpartners. They weren't assigned these. They chose them themselves in carrying out the Pathways Project. Now, as a final note, our investigator met with a man named Peter Changwa, a representative from Afrikaans Vandiri, and a fellow, which is a fellow prime implementing organization of dreams that worked alongside CRS in some districts in Zimbabwe, I think in Gweru. This Mr. Changwa stated that his organization had collaborated with CRS in what he called education, and he claims that CRS gave Afrikaans Vandiri access to children in schools to carry out sensitization on prevention of HIV. As part of this sensitization process, Changwa said it was necessary to provide condoms to school children as young as 11 or 6th graders. He strongly emphasized this point in the interview. Our investigators asked Mr. Changwa directly whether or not CRS supported Afrikaid's promotion and distribution of condoms in schools, and he replied emphatically, and I heard this myself, they do. Our investigators asked him a second time, as they were shocked at his response. And they asked him, CRS does not object to condoms? And his answer was, no, they don't. Our investigators pressed him a third time just to make sure. And they asked, so CRS, they don't resist you bringing condoms to schools? And the answer once more was an emphatic, no, they don't. They support. So in conclusion, first I want to state clearly that we are not accusing CRS of directly providing condoms or contraception in Zimbabwe. Instead, what we have proven in the course of our investigation is that CRS, in implementing dreams as mandated by the project's guidelines, knowingly fed thousands of adolescent girls and young women to partners who did exactly that. There could be no doubt on this point. CRS's own Zimbabwe chief deputy of party was only one of those who confirmed it. There is, in addition, video evidence from CRS itself. As related in the above report, CRS's own video presentation, how she learned about condoms as a dreams girl. Also, our investigation proves that CRS's own hand-picked implementing partners in the Pathways Project are peddlers of contraception and condoms for the youth, as well as purveyors of filth and perversion. One even refers girls to abortions. We showed that CRS participated in Stop the Bus events, which were designed to help facilitate access to condoms and contraception. Finally, we have an explicit statement from a key employee of one of these implementing partners in Zimbabwe, Afrikaans Vandiri, affirming that CRS provided them with access to youth, as well as supported their promotion of condoms. This is a scandal of the highest degree. It seems unlikely that this employee's recollection of CRS support is faulty, given his long involvement with both organizations. And there's more in the full report, including further details about dreams, more on CRS's collaborating activities, and further evidence against CRS's subpartners. Regardless of any carve-outs, CRS's participation in dreams and similar programs constitutes a public display of support for the spread of contraception in Africa. This was certainly obvious to the Africans who came into contact with the project, either as employees or clients. And now I'll hand the podium back over to Michael to tell you about the Dreams Project in Lesotho.
Thank you, Rob Gaspers, for that report on that rather sobering report from Africa. Now I'd like to bring Michael Hitchborn back to the podium to summarize our findings from Lesotho. Michael?
So the last portion of our investigation, or our investigative report, took place in Lesotho and it was done through the investigation that we did in 2020. It started there, and we, as Rob pointed out, it had to do with the DREAMS project. And what we found about Lesotho, we discovered actually quite by accident. While we were looking into CRS documents that promote condom use, because we found several, we found one that was titled HIV Information Training Manual for Adolescent Girls and Young Women. The inside cover of the document says that its contents are the responsibility of the For Children Project, which was headed up by Catholic Relief Services. The inside of this particular document also bears a 2018 CRS copyright, meaning it belongs to CRS. Beginning on page 11 is an activity intended to teach about behaviors that are either risky or not risky when it comes to transmission of HIV. The activity is accompanied with a series of pictures and phrases, and the girls are supposed to indicate whether the activity is a risk or no risk. Okay, so here is one sample page of the activity. Okay, it says, is this activity risk or no risk for getting HIV and AIDS? And it says hugging or kissing and touching and that sort of thing. Well, on page 14 is a picture of several people embracing. So here's the picture of several people embracing. In the front, it's a male and female. In the back, you have two females and also two males. And what it says is vaginal sex without a condom. The answer key on page 16 marks this behavior as a risk, explaining, quote, used consistently and correctly, a condom is 98% effective at preventing HIV transmission. The clear message here is that while not using a condom is risky, using one reduces the risk by 98%. Beginning on page 19 is an activity on HIV prevention. Step 6 has the instructor ask the group, quote, do you know the 3 ways to reduce the risk of getting HIV from sex that are A, B, and C? And then the instructor is to show the group A, B, and C cards. Card C, which is on page 23, shows condom. Remember, this is a CRS document, 2018 copyright. It says condom, and the description reads, quote, a condom is a thin rubber sheath that goes over a man's penis. HIV cannot pass through this sheath. If used consistently and correctly, condoms are 98% effective. Once again, this was created specifically for CRS's For Children project in Lesotho, and also was part of the DREAMS project. Another CRS For Children DREAMS project document that we discovered was a case study of the For Children DREAMS project in Lesotho titled 2 + 2 = 10. And again, it bears CRS's 2019 copyright on the inside cover. On the very first page of the document is the core package chart that you saw in Rob's presentation that acknowledged condoms and contraception as an integral part in the overall project. And For Children Lesotho was the responsible primary for 3 areas that are not directly related to contraception. Again, here you see 4 children components sequenced, and it has this blue carve-out that is separate from the portion here that says condoms, contraceptive mix, etc. On page 2, CRS provided another chart showing source material for its HIV curriculum and sex education course modules. One of the sources is a curriculum called Go Girls. And on page 3 of this CRS document, it actually has a hyperlink to the Go Girls curriculum published by Johns Hopkins University. Not only does this curriculum heavily promote contraception, but it actually includes a pornographic step-by-step instruction on how to use a condom. And once again, I had to edit the images. You can see here, okay? It's a step-by-step, and it actually includes the sex act in this area here, which again I censored because it was extremely graphic. What this document showed us is that CRS was implementing the DREAMS project in partnership with condom and contraception peddlers, Population Services International, JPIGO, and AIDS Free. With this information well in hand, PRI and Lepanto sent our research teams to Lesotho to look into the manuals used by CRS and its partners in the DREAMS project and its involvement in the continuation project called Karabo Ea Bafolo. Our researchers first visited the CRS office, inquiring about the DREAMS project and the manuals in use, but were directed instead to the Karabo Ea Bafolo office. The reason is that everything has been transferred there. There, our team met with KB officials, or a specific KB official who also works for CRS. This official informed our researchers that hard copies of project materials are unavailable, but promised to send digital copies via email. This official was initially reluctant to provide CRS documents to our researcher, explaining that, quote, the documents of CRS are sensitive, and they aren't supposed to be given to anyone outside the project. Nevertheless, the official did provide a copy of the Go Girls curriculum along with a few other documents, and they came through a crs.org email address. When we examined the Go Girls curriculum that was received from this CRS KB official, it was immediately clear that this was the very same document that we discovered through CRS's 2 + 2 = 10 manual. What that means is that what they cited in the manual is exactly the same as what they were using in the field. Our researcher also met with the Archbishop of the Archdiocese of Missouri to discuss CRS's activities in his archdiocese. The Archbishop said that he cannot really vouch for CRS because he really does not know what they are up to. He went on to explain that CRS sees itself, quote, as the donors and the ones who should determine which project to be financed without any reference to the local bishop. Instead, CRS supporting church projects, he noted, quote, they go off supporting others without understanding the local realities. During the course of meetings with Caritas Lesotho and the Karabo Ea Bafolo project managers, our researcher was able to confirm that CRS had originally been the prime implementer on the DREAMS project in Lesotho. When it transitioned over to what is now Karabo Ea Bafolo, it was nominally taken over by Baylor College. And we say nominally because nearly all of the staff who managed the CRS DREAMS project, which ended in 2019, have also transitioned over to its successor, Karabo Ea Bafolo. It is clear that the program now being carried out by Baylor College was the creation of CRS, even down to the hiring and training of staff. In fact, Baylor's 2020 annual report said, quote, the KB orphans and vulnerable children component is primarily under the jurisdiction of Catholic Relief Services as an implementing partner. Now, this is a huge problem. And the reason it's a huge problem is that KB is specifically intended to increase the use of condoms and contraception among vulnerable populations. In 2019, a 2019 USAID document outlining the Karabo Eyabafolo project clearly states, quote, "The KB activity will continue implementing DREAMS-specific related activities in these two same districts. The core package of services being implemented includes HIV testing, provision of a contraceptive method mix, condom programming." In the field, Caritas Lesotho told our research team that as an implementing partner of the 4 Children's Project and acting under CRS's direction, Caritas Lesotho participated in, quote, "community service days" with DREAMS partner PSI while participating in handing out condoms. As a side note, Population Services International was created by an international pornographer for the specific purpose of spreading contraception as a form of population reduction among the African population. As you'll see in this report, we have several other verified references, such as a peer-reviewed article on the DREAMS Lesotho project, whose principal authors include a former CRS employee, and an article by the African Sisters Education Collaborative, all confirming CRS's pivotal role in coordinating the implementing partners in these community service prevention days, or provision days. In August of 2022, KB published on its own website the involvement of condom promotion and distribution during a community service day, saying that its partners made services accessible such as, quote, unwanted pregnancies prevention for AGYW, which is adolescent girls and young women. And also said, KB also ensure availability and accessibility of both male and female condoms, including condom messaging. Again, this is on KB's own website, the project site itself, of which CRS is the most important key player in this entire project. And on their website, they said they're doing these service days and they're making sure that condoms, male and female condoms, are included as well as messaging. On its own social media platform, KB published pictures from several community service days showing condom demonstrations on a wooden phallus, like this one. Okay, you can see the demonstration. There's the demonstration right there. And the expression on the men, I think, says it all. We also found that they posted a picture. This is the Karabo Eyabafolo tent. It's a green tent. And right here in the corner is a giant box of condoms. And there are several boxes of condoms here on the table. After our researchers met with Karabo Eyabafolo and CRS staff at the KB office, a white PEPFAR vehicle was parked in front of the office, unloading big boxes of condoms to be brought into KB's office. In fact, one of our researchers even spotted an opened box of condoms set on a sink in the KB office bathroom and took a picture of it. That's in the report. The point here is that CRS and Caritas Lesotho are clearly involved in a project that is designed specifically to promote and spread contraception and condoms, and their participation is directly connected to this goal. There is no plausible deniability here. There is no moral get-out-of-jail-free clause that exonerates them from this. Both primary source documentation and in-person discussions and discoveries prove CRS's complicity in the promotion and distribution of contraception and condoms, and the facilitation of pornographic sex ed material. And speaking of the latter, one other piece of information that we obtained through our research team was that the KB project is using a comprehensive sex education manual called Stepping Stones. And I refer to the report. Please look at the report for all the details on how Stepping Stones is heavily promoting contraception and condoms, and even endorsing homosexuality and abortion. This revelation caused us to look to see if CRS had ever used this manual, and we found several CRS-produced documents published on CRS's website, plainly stating that CRS had used Stepping Stones also in Tanzania and in Sierra Leone. Whether or not CRS was using what it calls adapted versions of this grotesque manual is unclear. But as we've seen from its adaptation of My Changing Body in Cameroon, even its adaptations are not in line with Catholic moral teaching. But more to the point, there is no reason or excuse for a Catholic organization to be using any sex education program that contains grave moral evils, especially since CRS would have paid for the manuals for project implementation. And with that, I'm going to hand the reins back over to Steve Mosier.
Thank you, Michael. So as we've seen, there are problems in the 3 African countries we looked at, and of course in other African countries that we have gathered information about. And I think it's important when you think about the specifics, and you've been exposed to a lot of very specific incidents and information, to put matters in a larger perspective. You may remember that PEPFAR, which funds most of these programs, was originally intended to deal with HIV/AIDS. It was the President's emergency plan for AIDS reduction of President George Bush over 20 years ago. And as such, it tried to prevent the spread of AIDS among narrowly defined vulnerable populations, prostitutes, people with AIDS, that we were trying to stop them from spreading it by promoting abstinence, and also to help people to live with AIDS rather than die of it by giving them antiretroviral medications. You have to understand that that original intention to combat AIDS of PEPFAR has evolved over time into a population control program. PEPFAR funding is now going under the guise of dealing with HIV/AIDS. It is now going for population control ends. Those ends are summarized in the 2 phrases that we see again and again in the project descriptions. One phrase is increase the contraceptive prevalence. All right? Increase the contraceptive prevalence among whom? Well, not just the narrowly defined so-called vulnerable population, but among the population as a whole. The second phrase is, we found again and again, is increase the contraceptive mix. And that is to say, it's not enough to encourage people to use condoms. The young women and girls have to have IUDs implanted, or they have to have Depo-Provera injections every 3 months, or they have to be chemically sterilized in other ways by implants in their arm for 2 years at a time. So PEPFAR is now a population control program, and the goals of these programs are defined in terms that mean we are trying to drive down the number of babies born to African women. When you hear the phrase vulnerable girls, you shouldn't think of that we're just talking about girls who are sexually active or who are prostitutes. The vulnerable population is defined in these programs as the poor. Well, in Zimbabwe, Cameroon, and Lesotho, most of the people are poor. So if you say poverty is an indication of vulnerability, you've included the entire population of these programs. These programs are targeted at the entire population, not just those susceptible to AIDS. And when we talk about referrals, you have to keep in mind that we're talking about girls as young as 10 who are not sexually active and who are being encouraged by these programs to become so. Finally, you may have noted that some of the projects we described ended in 2022 or 2023. You must know that these projects almost always continue, sometimes under the same name, but often under a different name with a new project grant, but the same description and the same people are involved. So all of the things we're describing are contemporary. They are happening right now. So when you think about what it means for CRS to have implemented a sex education program that promoted masturbation as a form of safer sex, think about those girls. And when you think about CRS providing hundreds of thousands of dollars to an organization taking girls for abortions and lobbying for pro-abortion laws, think about those African girls. When you think about being the lead implementer of government programs specifically designed for the spread of contraception, think of the girls being recruited into these programs by CRS and then deliberately referred into the hands of people who, on the guise of protecting their health, destroy their souls. So to get into the moral questions surrounding these specific violations, each of which affect the lives in just the programs we've described of not just hundreds of girls or thousands, but tens of thousands of young girls, and each of which I think are clear violations of Pope Benedict's motu proprio. To address the degree of moral culpability of CRS in facilitating, if not promoting, such acts, we now turn to Dr. Christian Brugger, a well-known moral theologian. Dr. Brugger, if you would join us.
Thank you, Steve. Steve Mosher asked me to have a look at the report and to make some brief, I emphasize brief, ethical comments on it. And this is all I'd like to say. This report seems to establish beyond reasonable doubt clear examples of 5 expressions of grave evildoing. The first, CRS is a primary agent of evildoing inasmuch as its own public literature explicitly promotes masturbation, including to children. 2, CRS formally cooperates in others' grave evildoing inasmuch as it publicly endorses, refers to, and financially supports organizations that actively and very publicly promote direct abortion, contraception, and masturbation. 3, in other cases which are arguably instances of material cooperation, CRS's close working relationship with organizations that promote evil poses a very substantial risk of grave scandal. Its cooperation makes serious wrongdoing seem less serious and hence makes the choice for evildoing easier and leads vulnerable people to conclude that bad acts are good. 4, CRS's evildoing badly undermines the credibility of the Church's witness to the gospel in Africa. As an apostolate of the Catholic Church, its first purpose should be the advancement of the teaching of Jesus through its unique mission to care for the poor. CRS's promotion of abortion, masturbation, and contraception violate Jesus' very serious admonitions to protect human life, guard the souls of his little ones, and uphold the chastity of the marriage bed. Despite the good works that CRS performs in Africa, when people see that good commingled with evildoing, they are likely to conclude that the Church is hypocritical in its definitive moral teachings on life and sex, or that it wrongly teaches that abortion, contraception, and masturbation are gravely evil, and or that grave sin is not so serious. If the Church cannot be trusted to teach the truth on matters pertaining to the 5th and 6th commandments, how can it be trusted to teach the truth on other matters pertaining to salvation, for example, the real presence of Jesus in the Eucharist, the reality of heaven and hell, and the necessity of the Church for salvation? And 5, Catholics who financially support CRS rather than other secular aid organizations do so because they believe that its relief services are marked by something distinctively Catholic. By engaging in wrongdoing in the ways just mentioned, CRS acts unjustly to those donors by misrepresenting itself as Catholic. And I just would end by saying I support the report's recommendation to the bishops of the U.S. that in the absence of salutary change, the bishops, both individually and collectively, should withdraw their support from Catholic relief services. Thank you.
Thank you, Dr. Christian Brugger, for those comments. What does it profit a Catholic organization to save lives if in so doing it loses souls in the process? Today and tomorrow, all the bishops of the United States will receive an executive summary of our 120-page report. We've only just begun to share our report with those who will be most concerned about its comments, the African bishops. But I would like to share with you one early comment that we received, this one from Bishop Badejo, who is the bishop in Nigeria, who is in charge of the communications for the African Bishops' Conference, and so has assured us that our report will be circulated to the African bishops. Bishop Badejo says, "Thank you for this executive summary. Compliments to the Lepanto Institute for the valuable work. This will surely help us to keep our ears up, more especially in Nigeria, and I will share this with the bishops and others. Pope Benedict's teaching about not accepting tainted resources and materials for charity purposes remains valid as always." I say again, Pope Benedict's teaching about not accepting tainted resources and materials for charity purposes remains valid as always. May God vindicate all men and women of goodwill. Amen. And the first response we've received from an American bishop is from Bishop Joseph Strickland, whom I regard as America's bishop at large, who had this to say: "I urge everyone to read and take note of the work of Michael Hitchborn and his collaborators, the serious concerns he documents about how funds are donated by faithful Catholics and are used in ways that undermine Catholic teachings must be addressed. Michael has been exposing this corruption for years, but his protests and documented concerns have been ignored for the most part. The time to address this is long past, and it is essential that the Church in the United States finally acknowledges that this must stop." Signed, Bishop Joseph Strickland. And from Father Robert McTeague, we have the following comment: "Promoting or practicing promiscuity, contraception, or abortion constitutes bad medicine and bad morality. From the premise that the current collaborative report published by the Population Research Institute and Lepanto Institute is accurate, one may reasonably infer that Catholic relief services in Cameroon and Zimbabwe have partnered with entities promoting bad medicine and bad morality, namely promiscuity, contraception, and abortion." And I'd like to add one final comment from someone who's no longer with us in this world, the well-known moral theologian who went to his reward several years ago, Father Germain Grisey, who was a moral theologian at Mount St. Mary's in Emmitsburg, Maryland, with whom we at PRI had contact a dozen years ago when we did some research ourselves on questionable CRS programs in Africa. He wrote back in 2011, after doing his own investigation of the way that CRS was promoting condom use at the time, Dr. Germain Grisey wrote a blistering article about Catholic relief services called "The Church Betrayed." He concluded that the problems at CRS ran so deep that an outside agency needed to be brought in to help with a thorough house cleaning. He wrote, and I quote, "To ensure an adequate investigation and for credibility's sake, the board of directors of CRS will need to employ one or more appropriate, competent, independent agencies as the National Review Board used the John Jay College of Criminal Justice to conduct studies bearing on clerical sexual wrongdoing. This is, to say the least, a rather remarkable recommendation. The clerical sex abuse scandal was the greatest scandal in the history of the Catholic Church in America. Obviously, Germain Griset's review of CRS programs in the light of Church's teaching had convinced him 12 years ago, 13 years ago now, that he was dealing with something of equal gravity. His article focused on the evidence from CRS itself that the Overseas Aid and Development Agency was requiring its foreign partners to give, quote, complete and accurate information on condoms in all HIV/AIDS programs, and that the agency was cutting funding to partners who refused to comply. Moreover, CRS at the time, again, a dozen years ago, specified, quote, that any written material that contained information about condoms must not carry the CRS name or logo. Emphasis in the original. He underlined this, put it in italics to boot. This led Professor Griset to write, quote, I do not see how CRS policymakers can reconcile their need to distance the Church from such material with their responsibility to carry on a charitable apostolate in the Church's name. The issues we have discovered, I believe, Michael Hitchborn and I believe are equally grave, if not more so, and require a similarly robust response. While the specific violations of Catholic teaching that we have identified are new, this overall pattern of behavior, or one might say misbehavior, on the part of CRS is not new. The Lepanto Institute, Population Research Institute, and many others in Africa have identified many similar violations over the past dozen years. The violations have continued, in my view, because they are, in a very real sense, the cost of doing business with the federal government in general and with USAID and PEPFAR in particular. USAID PEPFAR projects require that projects promote condom use, increase the contraceptive mix, and promote the contraceptive prevalence rate in order to qualify for funding. A truly Catholic charity that refused to be complicit in such morally corrupt projects would be refused funding. So compromises have been made, various cutouts, carve-outs, set-asides, and artful dodges have been constructed to try and disguise these compromises. At the end of the day, it's hard to avoid concluding that it's all about the money. CRS in 2022 received over $1 billion in funding from the federal government, nearly 3 times what it received from the Catholic laity. And I'm afraid in this case, he who pays the piper calls the tune. We believe that there is an irreconcilable tension between the demands of the Catholic faith, especially in matters of sexual morality, and the dictates of those in charge of USAID PEPFAR. Is CRS a Catholic charity, the official international humanitarian agency of the Catholic community in the United States, as it calls itself, or is it just another non-governmental organization following the dictates of its chief funder? If you have any questions after reviewing the report, or right now after listening to this presentation, we would welcome the opportunity to answer your questions. Our prayer is that the Catholic bishops, joined by the laity, will encourage CRS to once and for all end their involvement in such projects. To have any hope of truly conforming, I think, to Pope Benedict's motu proprio, CRS should perhaps become an integral part of the U.S. Conference of Catholic Bishops, thus doing away with the pretense that it's a separately incorporated NGO with its own board of directors. It should carry out its international aid programs through the local diocesan bishop in the diocese where the programs are being carried out, which is currently not the case. Until and unless that happens, we have 2 recommendations. Number 1, faithful Catholics should direct their charitable contributions elsewhere. I understand the annual CRS collection is coming up this weekend. We did not plan this press conference with that in mind. We planned the press conference and then read the announcement that the collection was coming up. I suggest that instead of a contribution, you put a note asking your bishop to correct the problems at CRS into the collection box. Number 2, individual American dioceses should direct their contributions elsewhere as well. In the past, a number of individual bishops, including, for instance, former Bishop Sheridan of Colorado Springs, recognizing the compromises that CRS has made, have directed the charitable contributions of the laity in their dioceses to Catholic international aid organizations that have not made such compromises. Other bishops should follow their lead. We now have time to take questions from the media, and please indicate when you ask your question to whom you're addressing it. Do we have?
On that note, just to clarify, you said CRS receives $3 billion from the federal government?
$1 billion. And
oh, okay, it was $1 billion from the federal government.
That's correct.
3 times as much as they get from the Catholic bishop.
That's right.
Okay,
3 times
sorry.
as much as they get from the Catholic laity.
Okay.
They receive from the federal government. So the federal government funding dwarfs the amount of money that comes from the pew sitters, people like you and I.
Stephen. Joe McClane, iCatholic Radio. So it's on that point, you said the cost of doing business is these federal grants. Let me play the devil's advocate for just 1 second. If CRS were in the room, would they say, but hold on, we're getting money to do great things from a Catholic perspective, and there's just no better options to work with. There's no other organizations on the ground in Africa who will teach abstinence. Every single one all promote contraception, transgenderism, homosexuality, etc. We are just, doing our best, operating in a very broken place. Would they have an argument if they made that case?
No, because there are charitable organizations operating in Africa right now that Michael Hitchborn and I are aware of that do good work, including good work in this area. So that objection does not work for CRS. And if you take a kind of position that the good we do outweighs the bad, and therefore on balance you should support our work because we're doing more good than evil, I think that argument fails under its own weight. You cannot, do good. You cannot do evil in the expectation that good will come of it.
I'll keep that. This one's for Michael Hitchborn. Michael, I have been in the room when a bishop has said, I will not read these reports because it's all slander, it's all lies, it's a great organization, CRS, and these people are only out to do harm for the church. How do you break through that? How do we get bishops to actually consider the receipts that you have demonstrated today?
I would actually advise individual Catholics to try and get meetings with their bishops and say, look, Your Excellency, I would like to have a meeting with you to talk about finances. Don't say anything beyond that. And then sit down with our report showing the direct evidence. Okay, this is not hearsay. This is not something that we got from a third or fourth party. These are things that we got directly from CRS. These are interviews and materials that were collected from on-the-ground researchers meeting with CRS officials. So if the bishop is of goodwill, I believe that bishop will be able to look at that material and he will say, this is shocking and I didn't know. But it takes that one-on-one touch.
The African bishops just, called the wild card on fiducia supplicans at the Vatican, saying we can't promote homosexuality there. So wouldn't the African bishops see this and just go into full freakout mode? How is it they would allow this type of behavior from a Catholic organization and all their partners in their dioceses when they are so publicly opposed to homosexuality, perversions of all kinds?
It would be my hope, and I'm pretty sure Steve hopes the same thing, that The African bishops look at our report, examine its contents, and the ones in Zimbabwe, Lesotho, and Cameroon actually visit your own Catholic hospitals and look at the materials they're handing out, and then realize that these partnerships that were arranged by Catholic Relief Services are the problem. And if those bishops saw that information and recognized the problem for what it was, I dare say we would see that kind of response where they would get together and say collectively, enough. We don't need your USAID money. And there are good organizations. Steve mentioned that we are aware of good organizations. I want to point out one, Cross Catholic Outreach. Cross Catholic receives relatively similar amounts of funding from pew-sitting Catholics. They get around $200 to $300 million a year from pew-sitting Catholics. They do not take federal funding, and therefore they are not involved in the same kinds of collaborative efforts. Yes, sir?
You had mentioned several times throughout your talk that these girls are enrolled in these programs. What does that mean? Is it like an official thing? Do they get benefits, from these programs other than contraception?
Yes, when girls are enrolled in the DREAMS program, what happens is they go to one of the sub-partners like Childline or Africaid, or they go to CRS or one of the other implementing partners, and they will fill out a form. And it's a case management form that has their name, date, address, their birth, all that information, and they formally enroll that girl with documentation into the program. And the case manager will sit there and say, okay, in my interview with you, what seems to be the trouble? What do you need? And a lot of times it's something along the lines of, well, I'm looking to get myself financially established, or I need to continue my education. I never finished my education because of X, Y, and Z. And they'll enroll them in the program, and the case manager will say, okay, these are the services that belong to those particular checkboxes, and we'll refer you to the various organizations that are involved with those particular services. The ones that have to do with sexual and reproductive health, they refer directly to those organizations that are involved in sexual and reproductive health, like Renata. I saw the case management forms, I reviewed the case management forms, and even though they don't have the names of the organizations on those particular forms, they do have the checkmarked areas of need. And when you have in your SOP Renata, Horizons Femmes, SWAA, or any of these other organizations, as the partner that is involved in that particular area, you don't need to have it on the form. You just say, okay, we'll refer you at some other point. And that's what they do. Dr. Mannion.
Christopher Mannion, Wanderer Catholic newspaper. You mentioned Archbishop Lerotoli of Lesotho, who spoke of CRS as a donor, both to church projects and to others, subcontractors that they choose. Over the years, CRS has complained to folks on Capitol Hill that they are frustrated because they can't be major general contractors projects that include contraception or abortion, so they must be subcontractors, thus losing about 20% of the overhead that the general contractor gets for the home office and so on. So I wonder whether your investigators have discovered whether, for instance, any of these projects are funded by private donors as opposed to the distinctly funded and articulated federal program under PEPFAR and others. Have you found any evidence that they have used Catholic donations as opposed to federal government donations, given the Biden administration's pressure on Africa to open up DEI inclusion to mean homosexuality,
Right.
transsexuality, and so, of course, contraception
Sure.
and abortion?
Okay, so the question is basically, is there any evidence that delineates privately donated funds from Catholics sitting in the pews as separate from funds coming from the federal government? And the answer is no. And the reason that the answer is no is that CRS is identified as a religion, according to the U.S. tax code. And because it's identified as a religion under the U.S. tax code, they don't have to report a whole lot of stuff. But when they receive funding from the federal government, that funding does get reported in government reports, which is what we are able to track. And in looking at the government funding, we can trace down what projects, who's involved, what the aspects of the project are. And that's where we got the leads for putting together a lot of the investigative research that we've been doing. And I think Steve has something to add to that.
I would, as you well know, Dr. Mannion, from working on Capitol Hill for 10 years with the Senate Foreign Relations Committee, funds are fungible. And so once the money is deposited in the account of CRS, it is impossible to track individual dollars and cents in terms of where they go. But people need to understand that the process of applying for, qualifying for, and reporting back on the receipt of a federal grant is a bureaucratic nightmare. It's an accounting nightmare. The reporting requirements are onerous, which is why about a third of the money that you receive from the federal government in these foreign aid programs is spent in Washington, D.C., on the bureaucratic superstructure to make sure that all the grants are properly applied for and the money is properly accounted for by the accountants. Another third of the money is spent in the foreign capital supporting the heads of these foreign aid organizations at a level that princes would have been jealous of in the Middle Ages. And so only a fraction of the total amount of money that you get in terms of aid from the federal government, in this case CRS, actually winds up in doing whatever it does at the local level, be it good or ill. So again, contributing to private charities, just to give an example from my own organization, we built a church in China for $25,000. That USAID would never build a church anywhere, of course. But we sent ultrasound machines to Africa for $15,000. If a federal government agency tried to do that, you'd have to add at least a zero, if not two, to that figure to actually get the ultrasound machine in place in a local clinic where it would save babies and save mothers' lives. So this $1 billion in federal funding could probably be replaced by a few $100 million in funding from the Catholic laity if you did away with the government bureaucracy, the government regulations, and put the money directly into aid to the people through the local bishop who knows what his people need far better than CRS-based here in the United States does. This is ideological colonization, which has been roundly condemned by this Vatican, and quite rightly.
I do have one question from our online stream where we have media there. The question is, who would have the authority to remove the name Catholic from CRS? Would it be the USCCB or individual bishops? And the answer is very simple. It's individual bishops could, within their diocese, tell CRS, you're not allowed to operate in our diocese with the name Catholic. But the USCCB, in terms of the overall organization, is the only organization, the entity, that would have the authority to tell CRS you're no longer allowed to be called a Catholic organization. And that would have to be done either from the bishop, who is the chairman of Catholic Relief Services, or the bishop's board, who is over Catholic Relief Services. That would have to be their specific decision, but that's the basic nuts and bolts of that.
So is this happening only in Africa? The examples in this report that you've given us are African, but do we have evidence or rumors or anything to believe that they're doing the same thing elsewhere?
Yes. Back in 2012 or 2013, I was working with LifeSite News on a couple of investigations, and one of the things that we discovered is that in Cambodia, CRS had put together a document for the Phnom Penh prison in Cambodia for a particular project that they were working on. And in there, it actually gives instruction to a facilitator to say, tell the people participating in this particular discussion on HIV where they can access condoms. So yeah, we know that that's going on over in Asia. We know that CRS had representation on an organization called Medicam. Medicam was a Cambodian-based international aid and development thing specifically for doctors and medical professionals. And they had presentations that were promoting abortion, telling people where they can access abortion and why it's important to maintain the legality of abortion. And CRS was represented on the board of directors of Medicam. So absolutely, this is definitely going on over in Asia as well.
And Latin America.
In Latin America, we know that in, I believe, was it Haiti? I think it was in Haiti. CRS was involved in condom distribution programs in Haiti, and I can't remember what year that was. But
Latin American bishops have been complaining since 1971, my first visit, that the Catholic Church in the United States is funding the wrong things in Latin America because LBJ's new family planning funding, which the Catholic Church has never opposed, the Catholic bishops, unfortunately. That funding was being propagated throughout Latin America, and as Cardinal Ovando y Bravo told me, in Nicaragua, maybe they aren't getting their mail.
right. Well, our research doesn't go back to 1971, but we have seen evidence going back to the 90s at least of CRS being involved in programs in South America and in Latin America involving condoms. Yes?
Yes, so my question is regarding CRS's partners in the countries mentioned in the report. Now you mentioned that CRS was partnering with Caritas in Zimbabwe and Lesotho. Was there any evidence that they were involved with Caritas in Cameroon?
In Cameroon, yeah, I believe Caritas was, boy, I actually have to reference the report for that. I don't recall if we had evidence of Caritas in Cameroon being involved.
Okay.
But by and large, usually when CRS is operating a program in Africa at least, Caritas is usually involved, not always, but usually they're involved in some way. But when CRS is the lead on the project. If they're a sub-partner or a sub-recipient of the grant, that's a different story. But any other reporters?
So you talked about name changes, logo changes, things along those lines. You also talked about how these programs have come to an end as recently as 2022, I think, and maybe even last year. So, and then you also said that they kind of morph into a new name, but it's always the same people. So is CRS still actively involved in these programs today, or has their involvement come to an end, but the people who were managing it are still active?
So it's both and. In some situations, CRS will set up the project and it's carried out by somebody else later on, but by creating that root network, they create the infrastructure, and then after that project is over, others come in, take it over, and they start incorporating more strident promotion of contraception and condoms. That we have observed in the past. With these particular projects, the continuation project in Cameroon and the continuation project in Lesotho, both involve CRS heavily being involved with the implementation and transition of that project, including the hiring of former CRS personnel into the new project itself. So, do we want to take maybe one or two questions from the general audience?
Yes, certainly,
Okay.
if we have
I
such
think-
questions.
16 minutes.
Okay. Okay.
Let me just say that we have been looking, Michael and I, at these programs for a long time. I referenced an article by Germain Griset, the great theologian, from 2011, we conducted our first investigation of CRS in 2012 in Madagascar, which is the large island off the east coast of Africa, investigation of Catholic Relief Services. And the local bishops were furious about what was going on at that time. And the Archbishop of the capital city of the country said that CRS has a de facto monopoly on the overseas charitable humanitarian aid of American Catholics. And to remove that monopoly and to give a different direction to CRS, Archbishop Odon said, the Bishops' Conference of the United States should again take control of CRS and make it an agency of charity rather than a humanitarian agency. He did receive a call from Cardinal Dolan, who at the time was the chairman of the the board of directors of the Catholic Relief Services, but no real changes were ever made. An outside director was brought in, Carolyn Wu, but it turned out that she had been a 10-year member of the board of directors of CRS, so they're basically hiring someone from inside the organization. And the senior staff of the organization has quite frankly been there for decades. And so it is going to take, as Professor Grisey recommended so many years ago, a complete outside investigation of the agency, fundamental transformation of the agency to, I think, make it conform to Catholic teaching.
I think we can take one or two questions from the general audience if anybody in the audience would like to ask a question.
I'd like to ask the gentleman on the left there, on your right.
You're on my left.
Mr. Mosier or Dr. Mosier?
Stage right.
Yes.
My name's Kevin McCarthy, and I'm a lawyer and a consultant for Lepanto Institute. And the question I have is, in your work, have you ever raised the issue under canon law that a local bishop in Africa could prohibit CRS as a public ecclesiastical juridic person from operating in his within the confines of his diocese or archdiocese?
I'm not being a canon lawyer, I'm not really qualified to answer that question. I suspect that the answer is yes, that a bishop could forbid an organization that calls itself Catholic from at least operating in his diocese under that name. Whether or not he could take it any further than that, I don't know.
That hasn't come up.
That hasn't. I mean, local African bishops have told us, beginning 12 years ago in Madagascar, that they should stop calling themselves Catholic because they're not really operating as a Catholic relief organization, but as a humanitarian aid organization. But no African bishop has actually taken that step, to my knowledge. Now, in terms of the fiduciary responsibility of the board of directors of CRS to ensure that the funds they collect from American Catholics are indeed used in accordance with Catholic teaching, I suspect there would be an opening there for some action.
Thank you.
Okay, any other questions?
All of these were answered.
Okay. All right, well, thank you very much. Steve, do you have any closing comments?
Well, just thank you all for joining us today, and those who are watching, please pray for Michael Hitchborn of the Lepanto Institute and yours truly as we continue this difficult but necessary work. We're interested as faithful Catholics in primarily saving souls, and that's what this is all about. Thank you very much for joining us today.
Okay. Thank you so much.